Hi, everyone. Welcome to another episode of Unpacking Possibility. I'm your host, Tracy Stein. As always, I'm so happy to be here with you. You are going to love today's guest. She has such a wealth of information, not only to help us, but our beloved pets as well. So my guest today is Dr. Janice Huntingford. She is an award-winning veterinarian. She's certified in chiropractic, acupuncture, rehabilitation, and pain management, all the important things. She has a master's degree in traditional Chinese veterinary medicine and is a diplomate of the American College of Veterinary Sports Medicine and Rehabilitation. Dr. Jan also sits on a number of boards, including an international osteoarthritis task force and the World Association of Traditional Chinese Veterinary Medicine. So there's a lot more to her, of course, but I would love her to tell her story. So without further ado, welcome, Dr. Jan. Thank you so much for being here.
Very happy to be here, Tracy.
I'm so grateful that you're making the time to do this. I know you're an extremely busy person, and, this integrative veterinary medicine world is so important to me. I've had pets as long as I can remember, and I've found a very integrative approach to be extremely helpful, especially not only just for keeping them well, but also managing their care when they aren't. So
prevention is really one of the biggest keys of holistic health.
Absolutely. And I definitely want us to get into your thoughts on how we can keep our pets well from the get-go. But I wanted to learn a little bit more about your journey and how you really, you have such a depth of knowledge in all of these extremely important areas that unfortunately most vets don't get training in. So I'm wondering if you can talk about what kind of led you down this path.
Yeah, I'm happy to talk about that. It's kind of an interesting story. I graduated in 1984, never planning to be anything other than a regular, conventional, small animal practitioner. And that went along fairly well for about 10 years or so. But I did find that I would have patients that I could not get better. No matter what I did, no matter what specialist I sent them to, I just could not get these patients better. And it so happened that I had a patient who came to see me who had a back problem, and the dog, I still have a picture of this dog actually in my office. And so anyways, it was a little American Eskimo, and came to me and was having problems dragging its back legs. And I knew it was a spinal problem. We did some x-rays. So at that time, this was 1997. It was before the internet. It was before we had specialty hospitals. So if you needed to go see a specialist, you had to go to a university. So I'm close to Windsor. So I sent this dog to Michigan State University. And they said, yes, this dog needs surgery. They did something called a myelogram on the dog, which we don't do anymore, but that's what they used to do. They said, yes, there's a disc prolapse and there's a problem with pinching of the disc, and that's what's going on, and the dog needs surgery. And the client said, oh, I don't want to have surgery. So they came back, brought the dog back to me, and there I am, looking at Sissy sitting on my table. And the client said to me, I want another alternative. So I said, well, I'm a graduate of Guelph. They know everything there. So I sent the dog to the University of Guelph. Same result. What had happened was they basically said the same thing. The dog needs surgery. And the dog came back to me, and the client has the dog sitting on my table and said, well, when I have a back problem, I see a chiropractor, and sometimes I get acupuncture. And I remember sitting going, oh yeah, okay, so one of those. Because in that, I knew what chiropractic was. I had never been to a chiropractor in my life, but I knew of chiropractic. But I had not heard of chiropractic for dogs. And so, but he said to me, I want that for my dog. And I'm like, well, okay. I said, I can tell you that when I was at school, they told me this sort of stuff is snake oil. And they really said that. Somebody said that to us. This is just snake oil, smoke and mirrors, none of this works. No scientific evidence. And so he said, maybe so, but that's what I do. And I want this for my dog. So I said, okay, because you're my client, I'll look into this for you. And as I said, I was close to Detroit. So I used to do continuing education with the Southeast Michigan Vet Medical Association. And so I called up the secretary, Barbara, and said, Barbara, this is the veterinarian type of veterinarian I'm looking for. Do you know is there anybody in the area? What can I do? And so she said, as a matter of fact, there is. And she said, I take my pets there. And I'm like, oh, more people like this. Okay. So I sent this dog to this particular doctor, and darn, it didn't get better. And then, as things would have it, in the next 2 months, I had 6 other patients with the same problem who all wanted alternative medicine. And, you only have to hit me at the flat spot on my head so many times. And after about the 4th or 5th patient, I called up this doctor, and because I wanted to know what he was doing, how he was educated, and obviously what he was doing was working. So he answered me when he got on the phone. He said to me, I have been waiting for you to call. And I said, I'm looking at the phone going, okay, I've been waiting for you to call. And I said, he said, the universe has chosen you to do integrative medicine. I said, okay. So he said that you probably want to know what to do, where to start. And he said, so do you want to start with chiropractic? You want to start with acupuncture? And I'm like, well, I knew chiropractic existed. I'd never known what acupuncture was in my life, except that I thought it was some Chinese thing. And so I'm like, no, let's look at chiropractic. And so he told me where to get educated in animal chiropractic, which at that time, there was only one school, Hillsdale, Illinois. And the person who basically developed or founded animal chiropractic was a veterinarian who was also a DC. And her name was Sharon Willoughby, and she taught me. And Dr. Willoughby has since passed away, but she was the basically inventor of it. And there were probably about 40 students in our class. Some of the TAs now have their own chiropractic schools, and I met a bunch of people there who were very influential in my life. And I found out all these people were also doing acupuncture. And then one of them was starting a new basically form of medicine for animals called rehabilitation, and other people did herbals. And so it's like, how in The Hobbit, Bilbo Baggins says it's a dangerous thing if you put your foot outside your door and the road will take you. Well, that's what happened to me. So it went on and on. And I would have a patient that I still couldn't get better. And like, well, if I knew how to do myofascial release, maybe that would be helpful for this patient. So everything that I did was 100% patient driven. And it took a long, long time. And then, of course, I'm sort of a nerd, and I wanted to know about the science behind this, and I wanted to do the certifications. And then eventually I did my board specialty in 2015 in rehabilitation and sports medicine. So that's basically my story. And then I have felt that I need to give back. So I'm doing a lot of teaching now. I'm teaching acupuncture actually at my clinic. I'm affiliated with the Chi University in Florida. So I'm teaching acupuncture there. And I'm doing a lot of teaching and that kind of stuff. So
I love it.
That pretty much is my story.
And I love that when, you're on the other end of the phone listening to somebody say, like, I've been waiting for you. You didn't run in the other direction.
No, but I went, oh my God. Well, obviously something was going on. So anyway, but yeah, it has been a very interesting journey, and I got extremely interested in herbals, not only for myself, but also for my patients. And, became involved with the Pet Wellbeing Company, which is the fabulous holistic company that, of course, does herbals for people and for pets. And they had approached me, which was kind of an interesting thing. And I was really kind of a pain in the butt because I'm like, I'm not about to get involved with a fly by night company who, basically doesn't do things that would be the way that I would want to do with them. And so I sort of interviewed them before I agreed to do some work with them. But I've been working with them now for, I don't know, probably 12 or 15 years or so, and developing formulas and answering questions. It's a very science-based company. They really, I was able to do some research. In fact, I used one of their products to do my thesis for my master's. So I was really happy about that.
That's amazing. And that's actually how I came across your information, because I've been using pet well-being products for my different pets. Actually, a pet communicator who is also a good friend now is the one who told me about those products. And, again, like my integrative journey with my pets started a long time ago because I had a dog who had a mast cell tumor and they couldn't get clear margins. And what I was told from the regular vet was not encouraging. And I mean, it just a quick aside, but I mean, because you were talking about your journey being patient driven, I can't think of a better motivator, honestly. But my dog Cleo at 5 had behavioral problems, arthritis. She had, this mast cell tumor. And we were told, like, we could do radiation, but we'd have to put her under every week. And we don't know how much it's going to help her. And I just thought there has to be something else. And to make a long story short, I came across Marty Goldstein's book, The Nature of Animal Healing, which is a classic now. And I went and took my dog Cleo to Smith Ridge and saw one of the other vets there. And we've taken many other pets there over the years. But what struck me is that I had no other options. And Cleo not only lived beyond like the 6 months or year that we were told she would, she lived another 7 years. But not only that, she was in better health systemically. Her joints were better. Her behavior was better. She was more confident. So she coexisted with a cancer we could not completely remove, but her health was better and her life was longer and richer than we ever could have expected. That really set me kind of on a path. So, I know what you're saying about people calling it snake oil, whether it's for people or for animals. And I'm okay with people having opinions as long as they educate themselves. And everybody's so overburdened in their normal daily lives. It's hard for everybody to read about everything, but there is a body of research and there is ongoing research and there is clinical evidence of benefit for a lot of these treatments. And I love that you didn't shut the door to things that you hadn't been taught about.
Well, I think that I'm what they call a lifelong learner. And so if somebody tells me, oh yeah, they think this is great or this, I mean, the thing about like acupuncture and Chinese medicine, that has been in existence for so long that it's absolutely amazing. And I do a lot of consults with people for animals who have cancers. And I do use Chinese formulas. I do use some of the pet well-being formulas as well. The mushroom immune gold formula was actually formulated by Dr. Smallberg from the University of Florida, and he's a nutritionist there, and he's also a sports medicine diplomat. But he formulated this cancer formula based on research that he had done and used in his patients with mushroom stuff. And that one I think is absolutely wonderful. So there are so many alternatives for people who have pets with cancer. The thing about treating pets with cancer with things like herbals or maybe acupuncture, or, you're doing things like myofascial release massage. And big, huge thing, of course, for pets with cancer is diet. So if we're looking at doing um, a lot of these different things, many times the conventional veterinarians just haven't had any training in it.
Right.
Even in nutrition for cancer, they haven't had a lot of training in it. But it's amazing because you're 100% right. You get these patients so that they're so much healthier than they were and better. And I like to think about, if you're treating them from a holistic standpoint and you're treating their disease, that so you start with their disease at this, and it's going along and along and along, and then eventually the animal will not do well and they kind of fall off the edge. But that's as opposed to if I think about treating it conventionally, where they maybe start here and go down and they sort of rust away. You sort of sit there and they're just not doing well. And that's what we see, unfortunately, many times as humans, with our loved ones who have cancer, is that they're getting all of these conventional things and they're just wasting away. And people don't want that for their pets. So a lot of times the integrative approach, where we look at treating things with diet and that sort of stuff, helps them live longer than what the oncologist maybe thought they would do, but also have a much better quality of life. And then when they do go, they sort of just go suddenly, and it's the end. They don't linger, and it's the end, and that's how it is. So it's really kind of a great system, because yes, they live longer with better diet, with herbals, with all of these physical medicine, all these things that we can do. And it gives the people a chance to participate in their wellness, participate in their healing perhaps, and also be able to come to grips with the fact they're not going to have this beloved family member for very much longer.
Yeah, it's such a challenging journey. And, when you love someone, human or animal, you just want to do everything you can to give them the best life they can have. And I've seen, incredible things with my own pets. And again, please know I'm not knocking conventionally trained veterinarians. They're doing everything they know how to do. And it's just a different worldview. And we've availed, ourselves, my husband and I, of conventional veterinary care as well. But, I love that you're talking about the mushroom formula. It is potentially extremely helpful. I love that you also brought up diet, because I think a lot of people don't realize that we could do a lot better with what we feed our pets. Do you want to talk about that a little bit?
Sure. Well, first of all, I am an integrative veterinarian, so I do conventional medicine as well as holistic medicine, because I think the best is to take, a balance of the two. Sometimes you just need surgery. Sometimes you just need an antibiotic. But I think where Western medicine runs out of gas is with chronic disease, because whereas Eastern medicine, integrative medicine tries to get at the root of things. So that's why I think it's really good as a balance. So when I teach integrative veterinarians, I tell them, listen, you were trained for a number of years as a veterinarian and you know how to do a good physical exam, and don't forget everything that you've learned, because I think that this path has helped me be a better veterinarian. And one of the things that I did learn about, and I had the fortune of, when I went through my board process for sports medicine and rehab, that my mentor at that time was Dr. Joe Watchlag, who was a nutritionist at Cornell. So I learned a lot about conventional nutrition. I learned things about raw diets, how, that kind of thing. And so I understand where many conventional veterinarians are coming from, especially when you're talking about things like raw food. And what Dr. Joe basically had taught me was, Jan, there's very many different ways to feed a dog. And it has to be, everything needs to be complete and nutritionally balanced. That's the first thing. And then you can look at, giving the dog the best food that it can have. Now, for some people, if I said to them, you need to make a diet for your dog, you need to cook all these different things with this different recipe, that sort of stuff. If I said that to some people, they'd say to me, I don't cook for my family. So I'm not cooking for my dog. And so I get that. So you have to sort of meet people where they are and
Agreed.
go from there. Now, what do I think is probably going to be the best? A home prepared diet that's made with human grade food that's been balanced by a nutritionist, or you're using a balanced recipe from someone who knows what they're doing. So I think that that's the case. And then there are things that to that nice balanced diet that I think, from looking at it from a holistic standpoint, looking at it from, say, maybe the Chinese medicine aspect, is doing food therapy. So making sure that your animal is eating things in season. Like, really, if you're in a cold climate, it's winter, you and I really shouldn't be eating a lot of lettuce because that's cooling. You should be eating root vegetables and things like that. Sort of like what our parents used to do, because they didn't have the availability of everything that we have now. But so looking at eating things in season, I think, is important. And looking particularly with animals who are eating a conventional diet. Maybe they're eating a kibble because now the client has taken it from sort of field and farm down here, and maybe they're now feeding more of a premium kibble. Well, that's going to be an improvement, but I'd like them to then take some fresh fruits and vegetables, put them on top. Give this animal more of what they really need. And, and that's fine. And as far as raw food goes, if people feel that they want to feed raw, then that's fine. If they feel that they want to cook it, that's fine. Because I deal with so many old animals who have chronic disease, I think at least gently cooking the food is probably better for their digestive system. If you take a puppy, they may be okay eating a non-cooked diet. But certainly if you say, okay, I'm going to put my 11-year-old Boston Terrier who's only ever eaten kibble for its entire life, I'm going to put it on a raw food, that may not work. You may end up with vomiting and diarrhea. And I've had clients who've done that, and they're like, I thought I was doing the best thing. I said, well, the best thing has to be what works for your pet and what works for your family, keeping in mind all of the guidelines, keeping in mind perhaps the food therapy. And I love to do food therapy. So if I have a patient who has something like inflammatory bowel disease, a lot of that stuff is diet. So we look at sort of a basic diet. And then I look at things like, well, if we can incorporate something like barley into your dog's diet, perhaps it can eat that. It's not in a lot of dog foods. And barley is what they call a damp drainer in Chinese medicine. And if you drain the damp, what is diarrhea? Damp. If you drain the damp, you get rid of the diarrhea. So it's just one of those things. So I'm very, very big on doing food therapy, and with my family, with myself, and also with my patient.
I love that. Truly. I want to ask you, given that you've seen so many animals, is there something where you're like, this is the biggest health issue facing them today, or this is one of the things that I wish more people knew about?
Well, let's see. I would say I treat a huge number of patients who have obesity, and I think probably the number one thing that we see in our pets, because it leads to so many other things, is obesity. So if you have an animal that is obese, obesity is a disease of chronic inflammation. So obesity in dogs and in people can lead to osteoarthritis. So it's not only the excess pressure on that joint from the excess pounds, but it is also that the fat drives inflammation. So I will always tell my clients fat equals pain. And if you can do nothing else, if you can't afford to do rehabilitation or supplements or anything, you can't afford to get the dog to lose weight because you're feeding the dog anyway. And I actually will do weight loss consultations for people because that's something that a lot of my colleagues don't think about doing. They'll do that, with some of the more commercial foods, and some of the companies have really good weight loss calculators and things like that if you use them and that sort of thing. But I think obesity, because obesity leads to osteoarthritis, it leads to diabetes, and it basically you end up, Purina did an interesting study, probably, I don't know, 10, 12 years, it's quite a while ago now, 10, 12 years ago. And what they did was they took litters of puppies, and they put half the puppies on limited feeding and the other puppies were free fed. And these were all Labrador retrievers. So the ones that were free fed got considerably heavier than the ones that weren't. But they called this a lifetime study. They followed these pets for 13 years, basically till the last one had passed away. And the ones that were limited fed lived on average 2.5 years longer.
Oh, wow.
So the thing is that many times with these big dogs, it's obesity that makes them not able to walk, and then they get euthanized. So I think that the biggest thing is probably obesity. And because chronic inflammation, leads to osteoarthritis, leads to cancer, leads to diabetes, leads to all of these things, to lack of mobility, and then the dogs just don't do well.
I'm just thinking, among the other things I learned kind of early in my exploration, beginning with Cleo, that a lot of people are still surprised to hear about is that there are vegetables that you can safely give your dog, like steamed broccoli or carrots, something to kind of fill in the gap if you're trying to help them lose a little bit of weight, but also they have other health supporting properties. That's something very simple and pretty inexpensive people can do. Are there other things that would be easy places to start for people to help their pets live a healthier life?
Okay, so other than weight loss,
are there things?
Weight loss is I would say,
really
is the number one. Yeah,
Okay.
Weight loss is the number one thing, and of course, along with weight loss is diet. So, as I said, adding fresh fruits and vegetables. If you can't do anything else, certainly. Now, pretty much any of the salad vegetables, the cruciferous vegetables, broccoli, cabbage, those kinds of things. If you're going to feed those, they should be steamed because the dog won't digest them otherwise. But you can give them fresh blueberries, strawberry, any kind of the berries. There's a few things you need to avoid. Obviously, avoid onions, avoid avocados. They're not good for dogs either. And excess garlic. You can use a tiny bit of garlic, but excess amounts are not good. And so as far as fruits and vegetables go, those are
no grapes,
those
no
are
raisins.
pretty good. Well,
definitely
grapes, yeah.
deadly.
If you're talking about fruits, yeah, grapes,
right.
raisins, those you can't give.
No.
They can cause kidney issues, but pretty much everything else is okay, to use, and does have great health benefits. The other thing that I would say is that that's simple to do is start your dog on an omega-3 fatty acid supplement. And the omega-3 fatty acid supplements really work well for osteoarthritis, skin disease, heart disease, all these kinds of things. I do find that many of the veterinary products are far too low in the amount that you need. Now, 100 milligrams per kilogram is the dose that we use daily for dogs, and cats it's 50. And cats, you can't go over 50. Dogs, 100 milligrams per kilogram is what you're looking of, and not just fish oil, but omega-3. So EPA and DHA added together. So that's one of my favorite supplements. And then since I also do a lot of osteoarthritis, other favorite supplement is undenatured collagen type 2. It's called UC2. It is found in a number of veterinary supplements. It's also found in human supplements as well, but it's not regular collagen. It's undenatured collagen, and it works totally different than any other collagen. And that is something that is really, really good for arthritis, helps to prevent arthritis, because I'm really huge on prevention. So another easy thing to use is using a good supplement that has some probiotics in it. Probiotics, prebiotics. I happen to be a fan of Pet Wellbeing makes one called Spark, which is great, and the dogs love it, and it's easy to add to the diet. It's a green supplement as well, so it gives you some of those vegetables that you would like to have in the diet. So that would be something good to add. So those would probably be about my top 3 supplements. So you want to look at weight loss. You want to make sure that your dog's not eating too much. You want a great diet, and the supplements that I talked about. And then the other thing is exercise. Everybody needs exercise. So do the dogs. So people think that if they have a small dog, they really don't need to get any exercise at all, but they do. And it's a great idea, especially if you have a dog that comes from a working breed, or a breed, say a border collie, a dog that, comes from a line where they are used to having a job. Many times people get problems with their dogs, but with separation anxiety and with, destroying things in the home, because the dogs are bored and they weren't bred to do that. So, doing some physical exercise with the dog is amazing. The other thing to do is, take them to dog sports. There's all kinds of different things that you can do. They all don't have to be like Schutzen trained, like they're doing, protection work or anything like that. Certainly agility is a huge thing now, and that's something that you can do, but you don't have to be worried about national competitions. There'll be a little local competition for that. There's nose work that you can do, things like rally obedience. And there's lots of things that are fun for the dogs to do and fun for you to do. And it gives the dog something to do, gives you something to help bond the dog to you and, and understand. Because a dog that is doing these kinds of things is just going to be a lot more healthy mentally, spiritually, because dogs are meant to be moving and they're meant to be doing things. They really, there are a few that were bred, like pugs and Lhasa Apsos, that were actually bred to warm a bed. Actually were bred for that. And so they don't require quite as much exercise, but they all require exercise.
And our attention. And I think it's terrific that you mentioned that, because, sometimes people get an animal and they think it's just kind of like a pleasing object. And, that's, not, they're more than that. And they need the same kind of connection that we need. They need to interact with us.
Yep.
So I'm wondering if you have any cases that come to mind, totally up to you, but where you thought, holy cow, this is a better outcome than I imagined, or this really solidified your commitment to integrative medicine, seeing an animal do better than would be expected.
So yes, I've had a number of cases like that. There's one case, and this dog's name is Atari, and I think actually Atari ended up like on the web with pictures and all kinds of things. He's an amazing case. So this was a rescue that came to our clinic, and I do a lot of work with other different rescues. This dog was presented to me totally paralyzed. And I treat paralyzed dogs all the time. That's part of the neurological rehab that I do. But this dog was an intact female, 13-year-old American Eskimo, who they weren't sure how she became paralyzed, but they brought this dog to the rescue. Somebody did, paralyzed. And so they brought the dog to me because I've treated some other of their dogs. And I said, oh boy, I said, this is this dog has a number of problems other than the fact that it's paralyzed. It also was not very nice. It wanted to bite.
Oh,
But anyway, it was not happy. But anyway, I said, do you really want to put, the money from the rescue into this dog? Because it's probably going to be a long road. And they said, well, you've treated many of our other dogs with acupuncture. So could you just do an acupuncture treatment on this dog? And this was a quadriplegic. So it was paralyzed all four
oh my
legs.
goodness.
And I said, sure, I'll do that. And, I'll need to see the dog again in, 3 to 5 days, something like that. And I said, then once you have had a chance to talk to the other people from the rescue, you can decide what you're going to do. So they did that. And the dog was it was basically in lateral recumbency, could lie only on its side. And so they brought it in 5 days, and the dog was sitting up on its chest. And I'm like, oh, okay, that's good. It still wasn't able to walk. It wasn't moving its legs very well, but that was okay. And they said, well, this dog has a guardian angel. There's a lady who funds things for our rescue, who absolutely loves American Eskimos, cannot have one anymore herself, but she wants to pay for this dog's treatment. And I said, okay. So we basically worked on this dog, and I said, well, I don't know if the dog's going to walk again, but we'll do everything that we can. So we did acupuncture on the dog. We did some massage on the dog. We used pulse electromagnetic field therapy. We used laser on this dog. We put the dog in our underwater treadmill. Eventually, we did exercises with it. Put it on some herbals, and of course treated its pain. And I actually have pictures of this dog that I will show when I'm lecturing over a series of time. And we first saw the dog in February, and the dog was walking really, really well by the beginning of May, which was, I was not expecting that would happen. But that was an absolutely amazing story. And really great for the power of integrative medicine, particularly rehabilitation and acupuncture, herbs, things like that. So you did all that.
Oh my God, yes. And, most people would have given up on that dog, understandably. I mean,
Yeah.
it wouldn't be encouraging to see a dog that couldn't move at all. That's amazing. I love that you share that story.
Yeah. I treat a lot of paralyzed dogs. So I will tell people, don't give up on these. These dogs walk again. And that's one of the things that makes canine rehabilitation such an exciting field and a very rewarding field, because you can take dogs that really, they're like, I was told to just euthanize this dog. And I'm like, well, don't do that, because there are things that you can do that actually work very well. And sometimes in this case, they actually worked better than I had expected to. But most of the time, we can take these dogs who are paralyzed, and especially if we get them early enough and get them back to mobility. But yeah, I've had some cases like that. I've had dogs who have had cancer who lived way longer than anybody ever thought they would, using herbals and acupuncture. There was a dog with bladder cancer that I had that had gone to the specialist, and they biopsied it, and they knew exactly what was going on. They tried some chemo with it, but it made the dog really sick, that terrible bloody diarrhea. So then they decided to do integrative medicine, and we did some diet changes. We did herbs, and we did some acupuncture. And this dog lived 3.5 years. And the lady kept taking the dog back to the oncologist, and they would do an ultrasound and look and see what was going on with the cancer. And it was the same size, and, that kind of stuff. And I don't know, about 1.5 years later, the specialist said to her, "Are you sure that this dog actually has cancer?"
That's unbelievable.
And the client said, "Well, you diagnosed it." So, and I mean, it did. And eventually, but it was a huge, long period of time for this dog to go on doing really well. And so that was another one that went on. I had a dog with liver cancer, very much the same as well, that, we were really able to help it quite a bit.
Really amazing. I want to also mention to people that I have reached out, and messaged you. I know a million people do, so I wouldn't expect you to remember, but through Pet Wellbeing, it's so helpful to be able to get a thoughtful and educated response about, I've messaged saying, my dog has this condition. These are the medications they're on from their vet. This is where we are. And I'm looking to see if there's anything else we can give them to support them. And a lot of times, and again, very well trained conventional vets will say, I don't know about any of these 10 ingredients in this formulation. I can't advise you. And how incredible to get a response. And I wasn't charged for it, to say, this formulation would work for you. This formulation would not work with this medication, and so forth.
Well, I would. So
Huge.
Pet Wellbeing is a great company because they do that as a service to their customers. And because the idea is, I would really like it if all veterinarians would want to use herbals, but the reality is not everybody's going to do that. And so if we are going to have herbals that can be helpful for conditions, I'm very happy as a veterinarian to make sure that at least they have some sort of veterinary input. And most of the time I will tell people, be sure to tell your veterinarian that this is what you're giving your dog, as well as what you're doing with it. And I've had veterinarians reach out to me as well. But I would say that our customer service people, I do some training with them 4 times a year just to get them so they understand the basic things. Because if you have, for example, if you have a dog that's on blood thinners, there are definitely herbs you don't want to give along with that. And so that they can at least say, oh, well, I will pass this on to Dr. Jan, but you should know that this is, what's going on. So we try to do the best things that we can. And I think that is why this company is a responsible company. It's why I work with them, because of that. But we're always happy to talk to conventional veterinarians and say, hey, these are things that you can do. And I think, in my opinion, the low-hanging fruit for conventional veterinarians to look at with herbals is treatment of kidney disease, particularly kidney failure in cats, because there's not a lot for them. There are some drugs, and sometimes it's difficult to get the cats or the dogs to eat anything.
Yes.
But other than just a drug and putting them on a renal diet, that's what I see, because I see a lot of these patients who come in to see me, and the herbals that are used, Pet Wellbeing's herbals, some of the Chinese herbs that I use, that sort of stuff, acupuncture, fluids, because especially acupuncture in cats, because kidney disease in cats is an inflammatory condition, and acupuncture works as an anti-inflammatory. So we do that for dogs and cats. So there's been many, many of these patients who have gone on to have good quality of life for way longer than they would have in that case. And I mean, I've certainly treated dogs with Lyme nephritis, which is supposed to be a deadly disease, that we've treated with integrative medicine. That has been very helpful. So but it is good, especially with Pet Wellbeing, that you can get someone like me who will answer your question, or certainly the customer service people they're very good, and they're very well trained. They are not veterinarians, and they know that, but they're able to at least help you until I can talk to send you an email back or whatever, something like that.
It's huge. And just as an aside, my cat Petey, when she had asthma and kidney disease,
Oh
and
dear,
she
yeah.
did get weekly acupuncture and some osteoarthritis. So she had
Yep.
a lot going on, but with regular acupuncture and other things,
Mm-hmm.
she lived till 18, and then had like you
Yeah.
said, a steep,
Yeah.
rapid
Yeah,
decline. But
a rapid decline, which is probably better. There's actually acupuncture points that you can use in animals that are what we would call point of will points, because people are like, how will I know when it's time? So I said, well, I can put in some of these points. And what the points are really doing is asking the pet, are you ready to go, or are you going to rally? So what we see will happen if we use these in, and that doesn't mean you go up to a normal animal and put it in and it would kill them. It's nothing like that. It's not gonna have an effect with a
It's an
healthy animal.
acupuncture point.
It's an actually, there's a couple of them, but you basically are asking the pet, are you ready to go? And they will either rally and they do way better because nope, they're not ready, or they will make a sudden decline, and then the client has an easier time of making that decision. So,
That's unbelievable. Yeah. Dr. Jan, I know that you are actually on vacation and we're extremely kind to do this interview. I'm wondering, is there anything else that I did not ask you that I should have, or that you would want to mention?
Well, I would just say, if your pet is given an unfavorable diagnosis and it's like, well, we can't do anything, I would say reach out to a holistic or an integrative veterinarian. If you're wondering and you want to reach out through Pet Wellbeing, you can contact me that way, and we will talk to you. I will be very honest as to whether there really is anything that you can, because there are some things you just can't do anything about. But many times there are. So if your pet is given an unfavorable diagnosis, and I'm not saying that your conventional veterinarian is wrong at all, but sometimes there's just other things that you can do. So reach out to a holistic veterinarian. As I said, you can reach out to me through Pet Wellbeing. You can go online to the American Holistic Vet Medical Association, and they have a list of veterinarians in your area. The World Association of TCVM also has a list of veterinarians. The Chi University has a list of veterinarians who do traditional Chinese medicine, herbal medicine, rehab, acupuncture. There's also the College of Integrative Veterinary Therapy. So, and the International Veterinary Acupuncture Society. So those are all the ones I will tell people, because I never know who I'm talking to wherever they are in the world, to look into a holistic veterinarian as an alternative for your pet.
And I'll put the links to those organizations in the show notes, definitely, and to Pet Wellbeing. Do you have a website that you want people to go to learn more about you, or is it better to just refer them to Pet Wellbeing?
It's probably better to just refer them to Pet Wellbeing. I think there's a lot of information there. We do have a lot of resources for pet owners as well. Things that we have, pieces that I've written, pieces that other people have also written, just as information, for them. But yeah, if you go to the website, there's a lot of different things. But the easiest way probably to connect with me is to do that. And if I guess the other thing is, if you're looking at finding a rehabilitation veterinarian, I'll have to give you a couple other links. We forgot about those. The American Association of Rehab Veterinarians and the College of Rehab and Sports Medicine, because so many different things can be done for these pets. And so, as I said, all of these things that I've done have been patient driven. And if I can help one more pet, then I've had a good day.
Oh, thank you so much. I love that. Dr. Janice Huntingford, thank you so much for being on the show today. You can hear my dog Zelda shaking. She's in here with me.
My pleasure, Tracy.
I really appreciate it. This has been another episode of Unpacking Possibility. If you enjoyed the show, and I know you did, please remember to like, share, follow, leave me a comment, let me know what you think. And as always, until next time, be well.